Hi, I'm Gary Jacobs, and welcome to another edition of Long Island Backstory. This is a story that I was hoping that we wouldn't have to do, but unfortunately, we have to keep doing it. It's a story about the heroin epidemic here on Long Island and how it's destroying so many lives, so many children. This is our future. We're losing a whole generation here on Long Island and everywhere in the United States, for that matter. There's been a lot of shows and a lot of stories that you read. Every time a child is lost or there's a cluster of children that are lost, we read about it in the paper, and everybody is sad by it, and sometimes we see the funerals covered of these children, but then we move on to the next story. We move on, but the parents are still grieving, the siblings are still grieving. It changes your life forever. It's just not something that you can get over. And we've all been touched by it, either in your own family or you know somebody who's been touched by this problem. It's my intent not just to tell these sad stories, but the stories do need to be told, but to come up with some other solutions. The definition of insanity is doing the same thing over and over again, expecting the same results. We keep putting the same amount of money into programs, and we step it up a little bit, and we're told that we can't find money. There's just not enough money to do these programs. Yet we give police officers raises. We come up with money to do other capital products. In my opinion, this needs to be a #1 priority. You cannot not find the money for this, but we have to find out ways to spend the money correctly. I have here to my left Dr. Cidambi, coming from New Jersey. The doctor is an addiction specialist, and she's really dedicated her career to helping solve the addiction problem. And she has a unique approach to this, something different than the typical 12-step program that we're all accustomed to. And we're not here to say that that program doesn't work. In fact, she incorporates that program into her program. What I'm here to say is that it's another option when the 12-step program alone doesn't work. Let's try something different. And then we have some other moms here today that have all been touched by heroin. Either they've lost a child or they have a child who's addicted to heroin. And this is very tough for them, and I give them a lot of kudos, a lot of courage for doing it. You know, it's very easy when you go through a tragic event like losing a child or having a child addiction, just to crawl up and say, you know what, my life is over, my life is destroyed, how do I go on? And just go through day to day. But these parents are a special breed of parents, because they're here today to speak out, and it's very difficult for them to do, but they're here to speak out because they want to make a difference. They want to make whatever happened to their child not be in vain. So what I'm going to do first is just go around and let everybody introduce themselves, and we don't want to spend too much time on this part. There'll be pictures on the screen of their children, but I just want to let them tell a little bit about their child and what they're going through.
My name is Terry Kroll. I'm Timothy Kroll's mother. I'm also Jamie Kroll's mother. My life right now consists of being Jamie Kroll's mother and being able to hug her on a daily basis. I lost my son Timothy to a drug overdose 5 years ago. So my mom's job for Timothy is to advocate for these changes. I've done this for 4 years, and I will do this until I'm with Timothy again, because that's my job for Tim.
My name's Lori Carbonaro. I lost my son just over a year ago to overdose on February 27th on his older brother's birthday. I'm here along with Terry and these other moms to try to make sure that this doesn't happen to another family, another child, that recovery is possible, to advocate when we have to, all the time, and to find proper programs, new programs, things that will work. It's worth trying anything to try to get a child, a loved one, into recovery.
My name is Alice Jean Winterhalter. My son Charles, he's 20 years old. He has been in and out of treatment for the past 15 months. He's currently home now, and he's trying his best to stay sober. And I'm a parent advocate. I will do everything I can to help others as well as my son suffering. I recently became a recovery coach, so I made a positive out of his addiction, and I'm going to fight like heck. No matter what I can do to help somebody, I will help them. Thank you.
Hi, my name is Cara Ludwig. My 19-year-old son is an addict. He's actually clean for about 6 weeks right now. He started the Vivitrol shot. He's living in Pennsylvania in a recovery home, and there's nothing I wouldn't do at any point to help him stay clean or be there for him and guide him through whatever help he needs. You know, he's been through a lot. We've all been through a lot, but I will never turn my back. But I also won't enable anymore, or try not to.
Hi, my name is Marianne Gerlang. My daughter is Alexa, and she's 24. She's been in and out of many rehabs all over the United States, and currently she is a recovering addict. 3 months. I'm going with 3 months. She will say 6. It's a struggle every day, and I guard her like a hawk.
Thank you, ladies. Now I would like to ask the doctor, just really briefly, to tell us why your program is different than some of these other programs that are out there. And I know some of the women here were saying how their child was away at programs, which has to be difficult, having your child away, and of course very expensive on top of that. Tell us about your program and why it's different than some of the conventional programs that we're all familiar with.
Thank you, Gary. My program is an ambulatory detox, outpatient detox. Outpatient detox, many people use this word very, loosely. But this is the model which is very unique. No one has this model so far in New Jersey. You know, they say we were the first one to be licensed to be practicing at this level of care. What do we do that is so different? We take the patient who is addicted to, heroin or Xanax, alcohol, benzodiazepine, so we take them in and they come in around 9 o'clock and they go home at around 7 p.m. When they are in our facility, they get medication, they get to see the doctor, they get therapy from 10:30 to 3. They have back-to-back groups, and these groups really teach them, what to do to keep themselves clean. And then we also bring in AA, NA, these are the 12 steps program. And if a patient is resistant to not wanting to go to 12 steps, we kind of introduce that so they get desensitized to it. After all, it's not about God, it's about those 12 steps, which are very important to lead a dignified life. So we kind of incorporate everything in there. And this is unique because this has been like, if somebody gets no approval to go into inpatient, the family would say, we have been waiting for a bed to open up, or the insurance turned us down and there was no way to go to. Here we are. There is I can easily tell you, we have been existing for 2 years, zero denial for our level of care, which is very, good. So a patient, when they need help, we are able to give it to them. So that is one big thing about it. The second thing is that they come in, they might be motivated, they can be, like 20% of them wants to get clean, 80% of the same person might say, I can do some other drug instead of my drug of choice. Instead of heroin, I can smoke marijuana, or I can have alcohol. So they are still not fully motivated, but then we work with them. We make them understand seemingly unimportant things that you are doing will take you right back into where you didn't want to be, and that can cost your life. So we also work very closely with the parents. It doesn't matter if your child is like 18, 19, 20, 27, 48, doesn't matter. The mother and the father knows the child much better than anyone else out there, because when you lose them, we cannot be the ones who can say, I know the patient very well. So it has to be a family intervention in there. And you get to talk to our therapist the day when you walk in. And so you can easily reach the physician. So there is no bureaucracy in really, getting to be heard. And if the loved one, like if your son or daughter says, I don't want the family to be involved, I tell them at this level of care, you need to bring in one person from the family at least. And so they kind of work with us. And so there's never a time when the parent is not involved in this treatment.
Let me ask you, most of the parents, you guys have tried so many different things, and I'm sure, and I know when we talk about money, to me it seems ridiculous that we could even talk about money, because I know any of you would give any money in the world to have your child be with you or to have them be better. But if this option was available, Do you think that that would have helped you? I don't know what you guys have done. I'm going to pass the microphone around because you've all sort of we're in the same area. And what did you try? And I know a lot of parents, they feel like they're hopeless. You know, you don't want to do nothing because that's not the answer, but you sort of know that doing the same thing isn't working either. So sort of an open-ended question, but just tell us a little bit about what you've tried and if you think the doctor's program would work it. And we did a previous show where she said almost all the insurances cover it, but even if the insurance doesn't cover it, we're talking less than $500 a day that can save a child's life. And I know I'm preaching to the choir here, but you know, we need to really put the pressure on our legislators like you guys are doing. And how do you not come up with this money to give it a try? So Terry, we'll start with you.
Well, first I have a question.
Sure.
And my question is, I guess I should explain first. My son was only in one program because we didn't know, we weren't informed of how much care he actually did need to be in recovery. But during that 1 month that he was in a program, we were allowed in 4 times for an hour a week. And that was all we were able to spend time with my son and ask questions. So my question would be to you, in your program, I know the patient comes in on a daily basis, but where does the family come in?
The family is everything, as I said, because picture this, if you bring in your child, you'll be talking to the treaters, not once, not twice. You can come up with every question that you have. I have family members who ask me, this is the medication they've been taking, what do I do? And we would educate the typical, you know, intake, we call them intake when you come in first. We will sit down and we'll say, your loved one has been doing drugs. When you go home, please clean up their area. Let the parent know, you know, what to look for, the signs and symptoms of overdose. We ask the parent to sign this toolkit. This has been provided by SAMHSA. It's one of the treatment, guidelines that we use. They give a toolkit for overdose, what the parent should know, what the patient should know, how to deal with. If you walk into the room, when you see your loved one on the floor, you know, not answering, you know, unable to arouse, what to do?
How long is a patient expected to be there, and what does insurance cover?
The insurance covers pretty much everything. There's no denial for this length of stay. We get them if it is one drug, if it is only the opiate, like say the pills, pain pills and the heroin, it takes 7 to 12 days depending upon how much withdrawal symptoms, what they need. And if they are mixing that with other pills like Xanax, Valium, or they are drinking, then the detox would be a little longer. So give or take like 14 days, you know, if you have other drugs in there. But this has all been covered by the insurance. Once they are done with the detox, you all know it better than me, like, you know, living with a loved one with addiction. It's now no-brainer to detox somebody. The medications are all the same. You're going to give them, you're going to monitor them. There are nurses, there are therapists, so they're not sitting there and not doing everything, you know, anything. But at the end of the day, when they go home, they are getting to learn to cope. You know, as a parent, when you say something to them, they get upset and then they go, you know, back using to cope with the thing. So we kind of bring back the family member and the patient and put it together for them how to deal with each other.
But the total length of the program is 7 to 14 days?
That's only the detox.
Okay.
And after that, we step them down to partial hospital program, which is 2 weeks, Monday through Friday. The weekends, they are not there. Why do we do that? Because we are slowly teaching them to be independent. Like during detox, 9 to 7, they are there with us. And then they go home, pretty much take the medication and go home and sleep. And we teach the parent not to let them go out and be there for them. And, you know, we medicate them right so that they are asleep. So once they step down from detox, now is when they are really into the challenging world. So they go home around 3 o'clock and we want to keep up the sobriety. We teach them how to handle stressor on a day-to-day basis. And then they come back and we deal with the crisis right then and right there. So we've learned in these 2 years, I can proudly tell you that we never had one overdose. We have not had anybody who had a seizure, no stroke, no mishappenings in our program.
But have you had anybody come back for initial treatment?
Yes, they have. They have. when they come back, this is really nice that you asked me that question. The patient would say, I'm back here, guys, because I did not follow through what they asked me to do, which is they might do detox and say, I have my job, I need to go back to my job. I'm not going to come for 9 to 3, 2 weeks. Are you kidding me? And I say, that's not cure all. You're going to be back. And they come back. Or they might finish my program and then not follow up with the IOP because it's like 90 days. So I tell them right off the bat, you are here, you want to get better, you need to go for 90 days of treatment while you are in your living environment. That is the key. They need to learn, because if you go away and you come back, the stresses are right there. Right. And they go back to the pacifier, which is their drug of choice.
I have a question for the doctor. Just relating to that, the out treatment, that it's only for a few weeks. I think one of the things that's important is when they go away to the outpatient programs, they sort of drop out of society. They're not in school anymore, or they lose their job, and they're sort of, they're not forgotten about, but I think it's hard to adjust, even when you go away on vacation for a long time and you come back. So can somebody stay into their daily life in your program? Let's say they're in high school. How much time do they miss from school? Do you recommend that they don't go back to school? What do you recommend?
Taking a addicted patient and taking them away from everything is not a good idea. So when they are in detox, it's a medical necessity. So they might not be able to function well. But then if they are feeling better on day 3, 4, after the groups are over, they might be able to do their homework, their assignment, which kids do in my program. They sit down on the dining table with other patients and they'll be like working on their assignment. And they'll be calling their student counselor and say, I'm doing well, this is what I'm doing. It's a wonderful way of like keeping in touch with the community. And those who are working will be able to check back with their job and give the reassurance, I'm doing good, I'll be coming back. So it's not like you're cut off and nobody knows when you're going to be back. So it kind of gives you an opportunity to be with the community while you are in treatment.
Laura, you'll talk about your treatment for your son?
Well, Nick had to fail a couple of times at outpatient before we got inpatient in the first place. Like all of us, I think, would agree, if we knew more, if we were more educated in the first place. That's why I'm glad that you do have some family education. If we knew more, and if I know a girl actually that got clean, is still clean, thank God, to this day, in a shelter. So if they want it, they want it. And going back to their homes seems to be not a great idea, we are finding out. But in this type of treatment, I'm thinking that because you allow them to cope with going back home on a daily basis, especially if they're going to go home with their parents, the parents, first of all, need to be more involved. And I like that point that you make, that at least one family member has to be involved. Because you can't expect, like you say, that old adage, what is it? You put a nice, healthy, new tree in the soil that's not been clean, polluted soil, it's not gonna stay better. It's the same thing's gonna happen. So I do appreciate that, and I do believe that they feel more with every relapse when they come home. They feel more and more that they've failed. They let us down. They spiral down. They feel that they're no good. They deserve it. I've heard those words. He doesn't deserve anything better than that. His last recovery that he did have before he overdosed, when the temptation was too much, was that he did understand all that. He did. He really did. That he needed to do. He was the best he ever was as a human being. I got a glimpse of what my son was going to be as a man, and I'm glad for that. I just wish, like I said the other day, Terry and I were at another function, and I just wish we knew this kind of stuff 10, 15 years ago, 20 years ago, so we could have been there more for them, what they needed.
And I tell you what, every child looks up to the mother. That's what they learn.
Absolutely.
They want your approval. Mm-hmm. They want the mother to have that faith in them. Yes. And that's the first step.
Agreed.
That's the first step. Failure is not a failure. You got to show them you can do this. And I do that. And my patients and my staff call me a big mom. Big mom. Mommy is in-house. That's what they say.
Yeah.
Because no matter how old my patients are, they are my child.
Right.
That's the only standard of care that I can give.
Yeah.
Now, that's when I understand them.
But as a parent, it's just imperative that we know where to go to get information, because I know when we were in the crux of addiction and my son was wreathing in pain, I didn't know who to call or where to go.
One thing I just wanted to say that my daughter always says, as all the in and out patients she's been to, is that she does not get enough individual therapy in the programs. What she's looking for is to try and find individual help, and they're always in a group. So that's something that I think we need more of in New York, is more individual therapy, and also possibly to have them lined up with a job or some sort of volunteer position when they go outpatient.
Thank you for that. And I think one of the things I should have mentioned also is that we have all moms here today, but this is just as upsetting to fathers, and fathers care just as much, and extended family and siblings. For some reason, I think mothers are able to talk about this better. Maybe they find the strength better. As men, we sort of keep it in. So I just wanted to, I didn't want to end the show without saying that, of course, fathers suffer, and siblings and grandparents and extended family. It's a far reach. I'm going to pass the microphone around. If anybody wants to tell anybody watching the show, because people may feel alone if you don't know anybody in your community who had this addiction attached to them. Where could they get involved? And once they get involved, I'm sure you can lead them into other areas.
There's a site called The Addict's Mom, and there's also it's a Facebook page. My husband is actually on The Addict's Dad. I'm on The Addict's Mom. It's a safe haven. We come, get help, resources. You don't have, reduce the stigma. You don't have to be ashamed to share your story. And that's how I met all these wonderful ladies, is through The Addict's Mom. There's no friendship like the friendship like this. And I actually thank my son every day, because if it wasn't for him, I would not have met these wonderful people. So The Addict's Mom, you can find it on Facebook in the search engine.
Lori and I believe all of us belong to a group called FIST, Families in Support of Treatment. We are a grassroots group from Long Island. We go to Albany and advocate for changes in laws to help people get access to treatment and access to insurance to actually get treatment. I also belong to a group called PUSH, People United to Stop Heroin on Long Island. We're another group of parents. We're all together in this, and we just get together and we stand up and fight when we have to. Most of our groups are through Facebook. Just look us up.
Doctor, I think the program is great. And when my son first went into treatment the first time around, when he was in for 30 days, we had to fly out to Texas as part of the family program and it was great. And had I've known this, or this had come to New York, Long Island, we'll be the first family at your door.
Thank you.
It's just an awesome program, and the family involved. It's a family disease. The actions affect everybody in the family, and if we don't get help and we don't change, nothing else is going to change as well.
Absolutely.
And like when my son did come home, we literally changed rooms. Not only changed bedspreads, we switched bedrooms with him. He came home to a completely different environment, and he has noticed we've changed. And that has made a big difference.
A big difference.
A big difference. So getting family involvement, thank you for that, because a lot of them just put them in treatment and there's no contact with the family.
Can I, explain why? There is a HIPAA. Once you are, over 18, so I'm a grown-up.
Yeah.
My patients would tell me, I'm 25. How dare my mom, dad, they're like asking me to do X, Y, and Z. I'm not a child. And then I go, okay, let's see. You're 25, you said, right? Do you drive? No, I lost my license. Okay, who bought you those cigarette packs? My mom. So I go, there we go. Let's really grow up to be 25, and then you will be acting as a 25. And they don't take this as an attack. They laugh, and they go, you're right. And then we hug each other, and we move forward,
That's good.
Shame, stigma, and fear. Many times when you first heard about your child's addiction, go back and be honest about it. Did you feel comfortable picking up the phone and talking to other people? No. You wanted it to be, no, it is non-existing. we got to change that.
Yeah.
This used to be the show with psychiatric illness before we had the stigma. You know, this illness is nothing, in no way different from diabetes.
Doctor, what I liked about your program so far is that it seems like you take the person and you try to incorporate what you teach them into their daily life. Like they're going to have life skills.
Correct.
You know what I mean? Like you're just not going away to Florida, Pennsylvania for 30 days or maybe 6 months. It's all about, you know, withdrawal, and then you're all good, and then you come home. Where what happens when your boss tells you you're not doing a good job, get out of here, you know, like basic things that happen to people every day. It could be your car breaks down. It could be
Correct.
anything. And I think a lot of I'll speak for myself, like my son, one thing I always notice, he does not have good coping mechanisms at all with daily, you know, life. And I like the fact that, you know, you're going to try to get them back into their houses with their family. And because every family has some sort of dysfunction. I don't mean like
Correct.
we're bad, but, you know, it could be the silliest thing. But for this kid, they need to learn how to deal with that, you know, situation.
You said it all right. It's
Yeah.
a family illness.
It is a family illness.
You know, it's because of the family or because of the patient, like, you know, the
Yeah.
whole family suffers.
Yep.
And unfortunately, we're running low on time today. I didn't want to end the show without getting to some of the main points. You know, some of the things we spoke about here are important. I think all the mothers agree that if this was around when their child was first became an addict, that they would have at least tried it. Who knows if it would have worked, but it's certainly another aspect that we should try. Not just talking about the program, but what we need to do is we need action. We need to have our legislators, number one, come up with the money. People ask how much something like this costs. We have plenty of buildings here on Long Island that are owned by the county. Let's take one of these buildings. Let's take an empty classroom, and let's have the doctor put together a program here. Let's give it a shot. I asked the doctor how much it would cost to put together a program like this, and she said anywhere between $500,000 and $650,000. Can you imagine that we could save, if we just saved one life for that kind of money, it's worth every penny of it. We need to do it. But I'm putting out a plea here to anybody watching the show that has a little bit of extra money. There are people who make charitable contributions all the time to organizations, and they make a difference. What I'd like to do is, before the end of the year, I'd like to start it next month, is come up with a bus that we go to the doctor's facility that's already existing in New Jersey. We go there every day, 7 days a week, back and forth from a meeting place here on Long Island, and let's give this program a try. Let's give it the opportunity to show that it works. To put together a bus for 6 months, we're talking about less than $200,000, and we're looking for a sponsor. It could be an individual, it could be a group of individuals. Somebody can put together a GoFundMe. I don't care where we get the money, but we need to come up with the money. If you're a company, please sponsor it, get it done. I'm Gary Jacobs here for Long Island Backstory, and thank you everybody for being here today. And I'm sorry for all of your loss and what everybody's going through, but God bless you for doing what you're doing and having the courage to speak out and make a difference, because it's not only good for your child who are addicted and the people who lost their child, but their memory will go on forever because of what you're doing. Thank you.